Hello there, I'm Kate Miles from the Mind Body Reset, and I'm here today to talk to you about asthma and allergies. Now, an allergic response is a reaction the body has to a specific food or substance, and allergies are thought to affect 1 in 4 people in the UK at some point in their lives, especially during childhood. Now, some allergies can clear with age, but others may continue throughout life or develop at a later stage. Now, having allergies can be a big nuisance, but thankfully most reactions are mild and can be controlled. Severe reactions do occasionally occur though, but are uncommon. Substances that cause reactions are called allergens. Common allergens include grass, tree pollen, dust mites, animal dander, insect bites and stings, medicines including ibuprofen, aspirin and some antibiotics, plus latex, mould, household chemicals such as detergents and hair dyes, as well as food, particularly nuts, fruit, shellfish, eggs and dairy. Now, allergic reactions usually happen within a few minutes of exposure and can be identified by sneezing, a runny or blocked nose, red, itchy, watery eyes, wheezing and coughing, a red, itchy rash, a numb, tingly mouth, and increased asthma or eczema symptoms. Now, if symptoms become more severe, you may have developed anaphylaxis. This, of course, is a medical emergency and needs urgent treatment, so call 999 or 911 depending on your location. Now, if your symptoms are less severe, then see your GP if you or your child have had an allergic reaction so that you can be assessed and advised on how to manage that condition. Now, asthma is a common respiratory disorder that affects about 5 million people in the UK. Asthma can be allergic in about 90% of cases, especially with those who are under 16, being most at risk. Or it can be non-allergic, which is often triggered by repeated chemical exposure and can develop later in life. Now, symptoms include shortness of breath, wheezing, chest tightness and pain, plus coughing due to the airways becoming narrowed by muscle tension and inflammation. When narrowing increases, symptoms worsen, which reduces oxygen levels and is very serious and could potentially be fatal. Now, triggers are anything that irritates the airways and increases your need to breathe, especially exercise if cold or damp conditions are the case, and dust mites, pollen, fur, dander, smoking, being near smoke, chemicals, paint, glue, etc., plus environmental factors like pollution and stress. Now, spirometry can help diagnose or chart your symptoms, especially if they're worse at night, in the morning, or they vary, and peak flow can help monitor. Now, medical treatment may include preventer inhalers, steroid-based anti-inflammatories, which when used daily could minimise triggers, and reliever inhalers used as symptoms start to allow more oxygen in by relaxing the airways. If controlled by tablets or injections, however, this may replace your preventer inhaler. Medication interactions. Beta blockers are contraindicated as they oppose asthma medication, and anti-inflammatories can suddenly worsen symptoms in about 10% of sufferers. Vaccinations such as flu, pneumonia, COVID jabs, etc. could be essential, as contracting a lung condition can be serious. Regular reviews and action plans to keep symptoms and self-care on track are advised. But what can you do to help yourself? Exercise may be problematic, but fitness needs to be maintained, so walking is best. But do use a treadmill on cold or damp days. Maintaining an ideal weight as far as possible is healthier and makes it easier to move and allow rib function. Stopping smoking and vaping and spending time with others who do is very useful. Avoiding nail bars and hairdressers and at-home hair dye, nail varnish, regular cosmetics and perfumes, as breathing these in can irritate your lungs. And detox your cleaning products even if you have a cleaner. So do switch to homemade or eco-friendly items to reduce the risk. And food benefits. Carrots, leafy veg can give you vitamin A, but tomatoes also can, however they may be inflammatory. Folates like green leafy veg, beans and nuts, if you're not allergic, can be useful to boost the digestive system and the immune system. Vitamin C may reduce wheezing. Cruciferous vegetables have antioxidants. Garlic and onions may aid immune system function. Dairy may increase mucus production, and irritate skin, so may well be worth avoiding. Stress maintenance is key. Stress increases inflammation and causes muscle and airway tension, and poor lifestyle habits may become coping mechanisms which can further increase your symptoms. So managing your stress and maintaining your regular practices such as breathing exercises, journaling, gratitude and me time can all be very beneficial. And talking therapy can reduce stress, and sentimentology, a blend of hypnotherapy, guided visualizations and lucid dreaming, can non-traumatically clear your emotional clutter to reduce stress and may potentially ease your response to your non-serious symptom triggers and allergic reactions as a consequence. Now, if you're interested in how the Mind Body Reset could help you to tackle your health concerns, then please DM me to ask a question or set up a video call. Thank you for watching. I hope you found that useful. Goodbye.